Hi, I am Dr. Arathi Sreedhara, consultant obstetrician and laparoscopic gynecologist practicing at Milann Fertility and Birthing Center, JP Nagar, Bangalore. Vomiting is the most commonest condition a lady can come to us during her first trimester. She can either have mild vomiting sensation, or she can present to us with severe vomiting. So the most commonest cause for vomiting during pregnancy could be the hormonal changes which happens. The next few common reasons are genetic predisposition, the way she'll be eating her eating habits, her sleeping patterns, all these are related to her vomiting. The most common causes for vomiting during pregnancy is a surge in the hormones. So the commonest hormones are the human chorionic gonadotropin, estrogen and progesterone. All these hormones are increased, leading to expansion of the smooth muscles. It can affect the GI tract and thus it relaxes the smooth muscles and leads to vomiting. So the next commonest thing is genetic predisposition. So people who have family history of morning sickness can also have this symptom. The other common reasons why a lady can have vomiting in the early pregnancy is her eating and sleeping patterns. So if she has irregular eating habits and irregular sleeping patterns, it again affects on the hormones and she can present with vomiting. So the common risk factors for vomiting during pregnancy are people suffering from gastroesophageal reflux disease or any kind of peptic ulcers, if they are known diabetics, then if they have any underlying disorders like thyroid disorders, they are more prone to develop vomiting. And also people who are pregnant for the first time or who have had vomiting during their previous pregnancies, or if there is any family history of vomiting, all those people are more prone for developing nausea and vomiting. Vomiting is usually triggered by few factors like caffeine, carbonated drinks, then the smells like cooking smell, perfume smell. So all these, if the lady gets to know, then she can avoid and she'll be able to prevent nausea or vomiting during her pregnancy. Emotional and physical instability, stress, anxiety, fatigue, bright lights and loud noises, all these can be triggering factors to develop nausea and vomiting. Vomiting can be mild, moderate or severe. When do you say it is mild? When the patient is just having little nausea but not bringing out anything, it can be mild. So when it is mild, she'll be able to take water, she'll be able to take her foods, and when it is moderate, she'll not be able to take the solid foods but she'll be able to manage liquids. Severe is one when she's not even able to drink even water. So how do you manage mild vomiting? So by taking adequate rest, avoiding physical or emotional exhaustion, by avoiding bright lights and avoid taking small frequent meals, you will be able to manage mild nausea and vomiting at home. But when it is moderate, when you are not able to take solid food and if you are easily undergoing fatigue, then you might have to seek the doctor's advice and take some prescribed medicines. So when it is very severe, when the vomiting is very severe, it is called hyperemesis gravidarum, and this is the one which requires admission. So the patient will be severely dehydrated. She will not be able to consume even water, and this is when she requires admission, wherein we start her with IV fluids and she might require some kind of medications, and we'll be also finding out the causes other than the natural causes. Sometimes even urinary tract infection can present with nausea and vomiting, and once they are admitted, all these things can be taken care of. If you are facing any issues Visit Milann today to experience the top quality care and guidance.